All right, hello, welcome everyone. It is such a pleasure to be here today. I am Paolo Esposito, and I will be your host for this online Google Hangout session. We are so delighted that you could be here with us to this Hope and Health webinar titled, um, titled, that is interesting.
Yeah.
Yes,
Healthcare,
titled,
yeah, the
the
best
best
healthcare
healthcare you
plan
can get for absolutely free. It's
for
so catchy that it even escaped my mind there for a moment.
absolutely.
We're so glad that you could be here. I want to introduce a few people today. First of all, I'm going to start with Joel Sam. Joel, he's such a great person to have on the team. There's something about Joel that really excites me. He has a way with people. He knows how people work, and he's such a great guy to relate to. And he helps us with everything that's communications and also public relations and, of course, technology. And that's just one of the many things that he's really, really good at. And Joel, why don't you introduce yourself?
Yeah, absolutely. Well, thank you so much, Paulo. We're really, really excited about this webinar and to be part of the Hope and Health team and Find Hope Today. They've been doing just a great job in the Tacoma Park and DC metro area and just reaching people, reaching the community, really providing a lot of great resources in the areas of health and many other areas. So we're just excited to be a part of this. It's going to be a lot of great information you're going to be able to get over the next hour. So I'd probably kind of put your phone on mute, turn off any distractions. Really going to be some good information that can bless you, and if not you for any reason, definitely friends and family that you can be able to share this information with that'll bless their lives.
Definitely.
One other quick note is this is a very interactive session, so definitely there is a chat area right below the video there. Please feel free to put your questions in there, comments as we go through. This is not just a one-way communication. We want to hear from you. If you agree, if you disagree, if there's some questions you want to ask to go further in detail on anything that we ask here, please ask it in that question area, and we really look forward to answering as many of those questions as possible as we go.
Excellent. Thanks, Joel. So again, we welcome everyone to the Hope and Health webinar, the best healthcare you can get for free. Now, you guys know that if you followed Hope for Today for a little bit, we're all about bringing hope to our community. And one of the ways in which we can do that is through health. We are struggling, and many times we don't appreciate health until it starts to deteriorate. And that is why we have the pleasure to introduce Dr. James Gulley, who is our special guest today in the seminar. Dr. Gulley, welcome. How are you?
Thank you. I'm doing great. I'm so glad to be here with everyone.
Okay, very good. I want to start by introducing Dr. Gulley. I know that Dr. Gulley currently is serving as the chief of genitourinary malignancies branch, and he's also the director of medical oncology at the Center for Cancer Research of the National Cancer Institute. Now, I'm going to ask you, for the rest of us, for the simple people, what does that exactly mean?
So, great question. Genitourinary malignancies really just has to do with the cancers of what we call genitourinary tract. So this could be prostate cancer, where I have a lot of patients. That's the #1 cancer in men. It could be kidney cancer. It could be bladder cancer, which is the #5 cancer in the U.S., and or it could be testicular cancer. Those are the types of cancers that fall under the category of genitourinary malignancies. What I do is I have a group of investigators that work with me on trying to find new ways to either diagnose or treat patients with these cancers.
Okay, very good. Now, I happen to know Dr. Gulley on a personal level, and I know that if you read his resume, you would be impressed, yet he is also such an approachable and down-to-earth person. But he's a doctor of doctors. He has both a PhD and an MD degree. Dr. Gulley, you studied, if I'm not mistaken, at Loma Linda University. That's in California, correct?
That's absolutely right. I got both my MD and my PhD degrees at Loma Linda University. And I'd just like to add one thing about Loma Linda, and that is that their motto there, their subtitle, if you will, is to make man whole. And one of the things that we're going to talk about today is really how to come with this holistic view on treating the whole person and the whole body.
Okay, very good. And that makes me want to jump into the first question, but I'll hold on just a little bit, because I also understand you have been for quite a while part of the NCI, which is the National Cancer Institute.
Yes, I've been there for almost 16 years now. Actually, the end of this month, it'll be 16 years. And what I do there is, in addition to, as I mentioned, working with these other investigators, my own clinical trials look at ways to get your body's immune system to recognize and fight the cancer. So different ways to really engage the patient that has cancer, engage their immune system to fight the cancer. And so, a lot of what we're going to mention on today does play into the role that the immune system has in health.
Okay. And I also understand that you have written over 195 scientific papers that have been published in different journals and medical publishings. And for those who are interested, we may post links later where people could find some of those papers and research that you have been a part of. Now, I know that we're not here to just talk about your history, but we also want to talk about some of the practical ways in which we can achieve better health or optimum health, as some people mention it. Now, one of the hot topics today, if you live in the United States, and many of us happen to live here in Washington, D.C., so it's a particular hot topic here where we live, but if you've been alive for the past several months, you have heard about Obamacare. And it would seem, we don't want to get into the politics behind that, but it would seem that it's trying to address some of the fundamental issues in our healthcare today. And it would seem that in the United States indeed has a health problem or deficiency. In your perspective, Dr. Gulley, what is the state of healthcare today in the United States?
So I think that's a very good and pressing question. I think that one of the things when I think of healthcare in the United States is it is often used late. I did training at Emory University, and one of the hospitals that we would go to is Grady Memorial Hospital, which is a big two-county hospital there in the Atlanta area. And we would often see patients that didn't have access to healthcare that would come in very late with very advanced stages of disease into the emergency room because that was their only primary doctor source. And so I do think that having better access to healthcare is important. One thing that I'd like to point out, Paulo, is that what strikes me with the healthcare system in the U.S. is it's geared towards treating disease. We as doctors are taught how to diagnose and recognize and treat disease, but we spend less time on preventing disease. I think this has fallen, at least in the United States, largely to the patients, the general population. And so I think it really comes upon us as individuals to understand ways that we can find to decrease the likelihood of getting disease.
Okay. So in essence, the way healthcare is designed today, it treats a problem that's already there, but doesn't help to prevent it.
Yes, I think that's the way it has been set up and designed in the United States. That is the way the reimbursement is set up. I think that these types of things, some people, some groups like Kaiser has been finding ways to take patients in and teach them in prevention, things like that. I think this is cost effective if somebody is in a particular job environment for more than a few years. This could lead to significant cost savings. But largely right now this has fallen on the individual to take it upon themselves. And I think that each of us, as we are thinking about how we can make the best of our own health, we're going to have to be invested in that. We're going to have to dig in and say, what is the best for me? Nobody else can give that to you. You're going to have to do that for yourself.
Very good, very good. Now, because of the way that healthcare is set up, and even though things are trying to be changed towards a positive, change in healthcare, do you think there's groups of individuals who are most affected by this model?
Yeah, so that's a great question also. So I think that there are patients that are more affected by this, and these are the people that have limited access to healthcare and people that have limited education to understand what they need to do, or limited financial resources, so that oftentimes they can't buy the fresh fruits and vegetables, or have time to do the types of exercises and take care of themselves like they should. I'm hoping, though, that what we can leave people with today is something that is very simple, that doesn't take a lot of time, doesn't take a lot of money, but can lead to improved health for anyone who is willing to take these steps.
Very good. Now, Dr. Gulley, from previous conversations that we have had, I know that you have highlighted some very impressive statistics that help to paint a picture with numbers of how health really looks in North America. Do you have some of those figures in mind?
It was really staggering to me to start to look at some of these statistics. So one staggering statistic was the fact that 70% of all deaths in America are from chronic disease. Wow. Largely, these chronic diseases are preventable, and we'll come back to that statistic in a little bit. But billions of dollars are spent on treatment of these diseases after they're diagnosed. And I think that I really think the adage of a little prevention, can lead to a lot of cure. It's worth more than its weight when it comes to the treatment end of things. If you can prevent it, an ounce of prevention really is worth a pound of cure. So 50% of the deaths in America come from just 3 categories of disease: heart disease, stroke, and cancer. Fully 50%. And what is also an interesting set of statistics is that 1 in 5 Americans smokes or uses tobacco products, 1 in 6 Americans binge drinks, and 1 in 3 Americans is obese. Not just overweight, but actually medically obese. And so these are really things that can be modifiable, things that you can address, that we can make make a better step towards better health if we look at some of these things.
Very good. And I don't know if I missed it, but you also shared in the past some tremendous figures of how much money is spent on, I think you had a statistic there a few years back, how much we spent trying to treat those particular diseases.
Yeah, so it's a great point. So a lot of times when we come down with something, or we're told we have something, or we develop symptoms, we go to the internet. And one of the things I want to mention is that there are excellent sites on the internet, like the Centers for Disease Control, where many of these statistics are from, like the National Cancer Institute, like the American Heart Association. But there are also many other sites on there that are trying to sell things like dietary supplements. And in 2004, the latest date that I had full year statistics for, the Americans spent over $20 billion on dietary supplements. So these are things that often can be ordered through the internet, and these were largely used to help treat chronic diseases, and they're also largely based on very little in terms of scientific literature. And yet, what we're hoping to get across today are just some few simple steps that are not going to take any money. They're just going to take some time, some careful planning.
Okay, but those figures would seem to indicate that people do want to be healthy, and if we look a little bit around, we look. It would seem that health is a hot topic actually, and you have TV doctors. You can, during primetime television, not primetime, but during daytime television, you can flip through a few channels and find many programming in terms of doctors who are answering questions and giving advice, and there's so much marketing that it's also done on this front. However, statistics would reveal, because we're not healthier, that it may not necessarily be working, and perhaps it's causing more confusion than anything else. Now, something that you said that really, really strikes me is the fact that you mentioned that, and please correct me if I'm wrong, about half of the people in America suffer from chronic disease, and that translates to 7 out of 10 deaths being related to chronic disease. But the most amazing fact is the fact that these diseases are avoidable, correct? To what extent can you avoid many of these chronic diseases?
That's an excellent question. So what I can tell you is that we have some genetic factors, and that can give us some risk, and we have some other factors that are modifiable. These are things that we can control. We can't control who our parents were. We can't control our genes, but we can control what we eat, how much rest and exercise we get, how much if we smoke or drink. These are the types of things that we can modify. So the Centers for Disease Control, based in Atlanta, Georgia, Centers for Disease Control and Prevention, I should mention, that's very important, also known as the CDC, said there are 4 modifiable risk factors that one can use to decrease the chance of getting these chronic diseases. And they said that these are, and by the way, these are all either cost neutral or actually save you money. So they mentioned that this would include diet, exercise, decreasing tobacco, and alcohol. If you just did those 4 things, and this is based on the Centers of Disease Control data, you would eliminate much of the chronic diseases in America, including diabetes, arthritis, cancer, stroke, and heart disease. This would not eliminate it completely, but substantially decrease your chance of getting these diseases.
Can you give those 4 again? So we said diet, exercise,
tobacco, decreasing tobacco, just stopping it altogether, and alcohol. And alcohol, I think the important thing with alcohol from what the CDC is recommending is either abstinence or occasional use.
Okay.
I think Dr. Oh, go ahead, Joe.
No. We're getting some really good questions online as well. Folks keep sending those in. So when it comes to, let's start with the diet of those, right? So I think many people know out there, probably been hearing it since they were a little kid, eat your fruits and veggies, right? So how specifically does someone, what are some specific foods and so forth that, people can start to put into their diet of those fruits and vegetable families? What are some of the most important ones that are very helpful from a health perspective, cancer perspective, et cetera?
So, I think that is a great question. I think that my patients also ask this frequently. I typically tell them that what is most important is to try and get back to the diet that we all were, that was put here naturally on the earth. So you have the fresh fruits and vegetables, you have the whole grains, and you have nuts, and then Other sources of protein can include lean meats, fish and lean meats, and this is a much healthier diet to have than things that are ultra refined like cakes and other sweet things, things that have a lot of saturated fats or high fat content in general. Those things, if you get more than 30% or so of your calories from fat, you can have increased health problems. So I think as far as when it comes down to specific types of vegetables, I think the cruciferous vegetables like the broccoli, cruciferous vegetables like broccoli and Brussels sprouts, things like that, are loaded with vitamins and minerals and also have a good amount of fiber in there. Now, when one prepares them, I think steaming them is great. If you're going to deep fry everything, that's probably going to negate a lot of the health benefits that you're getting. So I like to see things as close to their natural form as possible and with minimal if you're going to have flour, it should be whole grain flour. If you're going to make things, the closer it is to the way it's found in nature, I think the easier it is to digest and the better off the health benefits are going to be. The less likely you're going to have leaching out of the minerals and vitamins that help the micronutrients that help make the food so nutritious.
Got it. So don't deep fry my vegetables and don't put cheese all over them.
Exactly.
Cheese and too much dressing all over them. It's probably not a good idea.
So to kind of summarize that, the worst things you can eat, so we can put it like two sides of the scale, are the highly processed things, and you particularly highly processed sugars. So as much as we like our candies and such, those are things that we should really avoid. And you also said something interesting that I think is worth highlighting. If 30% of the calories you consume are coming from those highly processed foods and fats, that's a pretty bad sign, correct?
Yeah, so more than 30% of your calories from fat, that's you want to shoot for under that to have the optimal health benefits, especially your heart, but other things too.
Okay.
This is just a general situation. If there are specialized situations where you might want to have slightly different caloric intakes based on if you're going to be in the Arctic for long periods of time. There's some Inuit Eskimos that do eat higher fat content, but and don't have damage to their health. But I think in general in America, that is what you should aim for.
Yes, most of us are not living in igloos in the Arctic Circle, so
right.
we can shoot for something a little shorter. Joel, you have something you want to share with us?
Yeah, no, a funny graphic that just kind of ties in with what you just said, Dr. Gulley, and this was on the Find Hope Today Facebook page. I don't know if you can both see that there, but I saw this graphic and it lined up so well with what you were just saying. I would guess that you'd agree pretty strongly with this.
That is wonderful. I like it. If your food can go bad, it's good for you. If your food can't go bad, it's not good for you. It reminds me of that. I'm sure many people have seen this, but one of the chain burger restaurants had a meal taken from there that included a burger, and they did video capture over 1 year, and it still looked perfectly fine and edible, even though I'm sure it was very hard, but it didn't go bad.
Wow. And that just gives testimony of how many preservatives and things they put in those highly processed foods. Now, Dr. Gulley, I want to be very realistic and straightforward. I know that there's huge trends out there about veganism and vegetarianism. I'm happy. I live here in the Washington, D.C. area, and if you go to many restaurants, you start seeing that many restaurants start marking in their menus those meals which are vegan, those who are vegetarian and carnivore. Now, someone who perhaps has been raised eating all sorts of meats and things like that, it might be a really hard transition to go from eating absolutely everything one day to going, we could say, completely vegan or raw one day. However, I would like for you to perhaps share with us, is there value in at least making progression towards a more, and something that you said that I think has a lot of value and makes a lot of sense, the closest you can get to how these foods are naturally, on their natural state, the better. Does it make a difference to even make an effort? You know, if you started here to progressively come down the line to until you get further down, or does it have to be everything or nothing?
That's a really good point. I want to stress the importance of moderation here. I think that, you know, you can get incremental benefits by decreasing the amount of, I would say, food that is either has too much fat in it or junk food. But specifically talking to your point on meat or no meat, I would say that there are studies out there that suggest that patients, or rather people that eat no meat, do have certain health advantages. There's decreased chance of getting colon cancer, for instance, a substantial decrease in that. There's decreased heart disease for vegetarians, vegans, and it's not such a bad option. One option might be to do something like Meatless Mondays. A lot of people I know will say, okay, we're going to do, you know, just 2 days a week or 3 days a week where we're not going to have meat. We don't need to have these big steaks every day, or
Right.
we can have some alteration. So I think it's
Very practical.
And if we actually were to go back and look at our grandparents or our great-grandparents' generation, meat was not something that they had every day. It is, I think, become more common as our society has gotten more affluent, and we've had better agricultural techniques. But I can tell you that from a going green standpoint, it takes about 10 times as much land and energy to get the same amount of calories from a cow, from meat, as it does for vegetables. So I think that there's many reasons, both from a health standpoint as well as from a going green standpoint, that cutting down on the amount of meat that we eat it actually makes sense.
And even, you know, the ideal is to get as close to that, you know, going green and natural foods. But even that concept can even somewhat apply to meats, you know, highly processed meats such as hot dogs, patty. I'm guessing that could probably be a little worse because of all the things that are added to those foods than perhaps a leaner steak as you transition, you know, from rather very unhealthy diet to making baby steps to a healthier diet. Is that correct?
Yes, I would agree that the more a food is processed in general, the more chances are that the nutrients are leached out, or that there's, you know, kind of, you know, with the giblets, with kind of the leftover pieces put together. You know, I think that you have to watch those types of things, because maybe that's not the ideal part. I would just want to also mention, though, that there is always the chance of either diseases, but more importantly, even toxins that can be concentrated in meats over time. So that's another health concern. I think, though, I don't want to dwell on that. I want to just dwell on the fact that if we want to get back to, I think, what the human body was made for, I think it would be more of a plant-based diet, and basically studies comparing people that eat pure vegan versus ovo-lacto vegetarian versus pesco-vegetarian, which means eating fish plus a plant-based diet, versus omnivores, which eat anything, suggest that the less meat you eat, the better off you are. in terms of many outcomes, including cancer and heart disease.
Okay, very good. So perhaps to summarize the diet section, the nutrition section, and Joel, please feel free to interrupt me at any time, but we could say that the optimum then is to eat, as close to natural as possible, many raw foods. But at the same time, if you make baby steps, which would mean perhaps going from less processed foods, making the transition, and then something that you suggested, maybe also in the quantities and how often. So perhaps you still eat, a steak every now and then, because we have to realize different people are going to be in different steps along the way, and perhaps cutting down on the frequency. If you eat every day, maybe going back to eating just twice a week, then once a week, then eliminating maybe that juicy burger that has a lot of processed foods. All those steps towards the right direction can impact our health until we get to that optimum area. Is that so?
Yes, and I exactly agree with you on the moderation is the key. So, getting rid of meat and then eating cake all day long is going to be. So I think you have to, you have to figure out what is good for you, how you can keep yourself satisfied, and I think if you take out, if you just go incrementally and you have more fresh fruits and vegetables, I think that can be the key to the step to better health.
Okay. Now,
so we're getting a few, sorry to interrupt you there, Paul, getting a few good questions from our audience here, and definitely want to make sure we ask these. So one audience member asked concerning, she's actually on a plant-based diet, or maybe this is referring to someone else in her family, but what could still cause high cholesterol even after someone is on a plant-based diet is her question. Your thoughts on that?
That's a very good question. So cholesterol is a normal product made by the body. We need that for the cell lining. But what happens is some people are genetically predisposed to making more cholesterol. So how can we decrease that once we eliminate it from the diet? So what are sources of high cholesterol in the diet? Well, cholesterol is only made in animals. It's not made in plant cells. So it has to be animal source for the cholesterol. So that could be cheese, milk, eggs. Egg yolks have very high cholesterol. It could be shrimp. It could be, any type of meat. Things that we can do besides cutting down the cholesterol in the diet include exercise. Exercise is a great way to lower the bad cholesterol and raise the good cholesterol so that your heart is much more likely to be protected. I can tell you from my own personal standpoint, my cholesterol was high when I was going through medical school and in my early training, and I started on an exercise program, and with also some medication, was able to get my cholesterol level down, but it's now down to the point where I don't really need the medication, and just with the exercise program, my cholesterol is much better.
Very good. Joe, is there another pertinent question in terms of health? Because I wanted to transition to the next one that it ties in perfectly to this. Do we have anything else about nutrition?
So we have one more here that I think would be a good fit, and so it's there that many vegan/vegetarian alternatives seem to be high in sodium. So is everything that is quote unquote vegan or vegetarian going to be necessarily healthy? So there's the process component there as well. If you could speak on that.
So I think this raises a very good question. There are many meat substitutes out there that are available. They're available in your local health food store. And these meat substitutes can be high in fat. They can be high in salt or sodium, as the listener suggested. I think that one thing to look at is to look at the label. There are some that are lower in sodium and some that are lower in fat, but just because it comes from a plant-based doesn't necessarily mean it's that healthy for you. So again, like anything else, anything that's highly processed, probably less healthy, harder to digest than taking the soybeans and eating the soybeans and getting your protein that way.
Got it. Got it.
Very good question. Now, I know my wife is strictly vegetarian. I'm mostly vegetarian since I married her, if not completely. And one of the concerns we just had a baby. He's only he's 15 months old. I think, Dr. Gulley, I think you got a chance to meet him. I don't know about you, Joel. But we're obviously raising him vegetarian as well. And one of the concerns that we had was iron when they're developing in young age. Are there any nutrients that are sometimes lacking in a vegetarian diet, or is that purely a myth and there are great alternatives out there to get those nutrients? And then that's the last question, and then I'll transition to the next point.
I think that's a great question. I think that a lot of doctors, if you'd ask them maybe 20 years ago, they would say, well, you can't live and be a vegetarian because you don't have any sources of your B vitamins. And so how can you possibly do that? Well, since then, studies have shown that, of course, there are no complications with that. There can be people that have low levels of vitamins for certain genetic problems because they can't absorb those vitamins. But in general, you don't need a animal-based diet to get any of your essential vitamins, minerals, or fatty acids. And I was raised vegetarian from birth. And I've turned out to be relatively healthy, relatively normal, 6'3", so it didn't stunt my growth. And a lot of times people look at me and they say, really, how did you get to be so tall? You're a vegetarian, It's all good.
Very good, very good. Okay, you already mentioned it, but I think when we're talking about health, there's two things that go hand in hand and are sometimes interchangeable, and that's exercise. You mentioned already when we were talking about cholesterol, exercise. And some people may want to think, which is more important? Do they complement each other? Does one come before the other, or do they work together? What are some of the things that you can tell us about exercise?
So I think it's a great question. I sometimes, if you were to ask me, which is more important, nutrition or exercise, I would say, it's kind of like asking me, which of my kids do I like best? Which is better, my son or my daughter? Which one is more important to me? They're both important, and they both, if you want to have optimal health, you need to have both of them. It's also kind of like saying you're in the desert, which is more important, to breathe or to drink water or to eat? We need all of that to be healthy. So yes, exercise is so crucial, and there's so many people in America that don't get enough exercise. The minimum amount of exercise that is recommended for Americans really is half an hour of moderate exercise a day, at least 5 days a week. Many of us don't do that. So let's take a step. Now, what is moderate exercise? Well, that's
what I was going to ask, yeah. What does that mean?
So that's basically if you're walking fast enough so that if it's a long sentence like many of mine have been tonight, you have to take another breath. Or if you're singing a song, you can't really, you kind of have to stop in between stanzas to catch the next stanza. You can't go through the whole song. So that type of thing, if it gets your breathing going, that's moderate exercise. So pretty brisk walking or jogging, swimming, also biking. Many ways you can do this. Walking is just one way that's free and doesn't have too much impact on your joints as you get older.
Go ahead, sorry.
I was going to say that enjoy walking every morning. I decide that if I can do it first thing in the morning, it A, helps me think about the day, get everything in perspective, and it also gets me mentally prepared for the day. I can kind of go through things, and I feel good after I get done walking, and I'm just ready to go.
Now, I think what you said gives a lot of people hope, because not many of us can probably do some of the popular programs over there. I hope I don't get in trouble for mentioning them by name, but I know there's a lot of programs. One that my friends are doing is P90X, and that's quite extreme. I'm sure that a lot of people could not keep up with that P90X. I don't think I could keep up with the P90X for more than one or two days.
It's pretty tough. I've done it. It's pretty rough.
Exactly. Yet you don't have to do that much in order for it to improve your health. Is that so?
That's absolutely true. So just what I have chosen to do is I've chosen, actually, and I'll show you here. I'll unclip it from my belt. I've gotten this little pedometer here, and this pedometer keeps track of the number of steps that I take each day. And there are good studies out there suggesting that if you get less than 5,000 steps a day, you have what we call a sedentary lifestyle, so that you're not really getting up and moving enough. It's only when you get over 10,000 steps a day that you get into the active lifestyle, and that's where I think you need to be for optimal health.
That's really useful, because a lot of my day, Paolo will tell you, I'm a technology guy, and we help churches with social media, and I'm sitting in this seat for I guess on a typical day, maybe as many as 7 to 9 hours, 10 hours at times. So being able to, and I have found and been trying to take small breaks and maybe go outside and get a 10-minute walk or so. But it sounds like if I can do more of that, that'll help to. Millions of people are no longer working outside or manufacturing. They're sitting at a computer like we are right now. So it definitely does present a challenge.
You're absolutely right, Joel. I think that the vast majority of Americans have sedentary jobs. We don't get the exercise that our great-grandparents got out on the farm.
Right.
We sit at the computer all day long, or we, sit driving somewhere all day long. It is something that we need to change, and I think you brought up a great point. I love the idea that you get up every few hours and go take that 10-minute walk. That can refocus you. There's studies showing that you're sharper when you do that. You have better work productivity. Your bosses will love you for that, and your health is better too.
Now, Dr. Gulley, a lot of people go into these exercise programs, whether they realize it or not, sometimes consciously or unconsciously, just because they want to look great, and and for the aesthetics of it, they want to go and do all this exercise to lose weight and look better. However, from what you're saying, it would lead me to think that sometimes, even though aesthetically we may not get a huge result, health-wise we can get a much bigger result, even if it doesn't completely reflect visually. Is that so?
So I think the most important thing is your health. Looking good is all fine, and I would say that this will actually help tone and help keep the weight down and those types of things, and that is also important for the visual aesthetics. But I think more important than that is, what's your quality of life? If you look like a supermodel but you had really bad arthritis, or you were going to die in 5 years because of cancer, is that really worth it? I would say, if you want to have the optimal health, do the exercise. You're going to lose the weight. You're going to look better. You're going to be more toned. You're going to feel better. Your energy level is going to be higher, and you're going to be able to have a sharper mind too. So it really, exercise pays off in so many ways.
Okay.
Just because you mentioned.
Go ahead, Joe.
Yeah, I was going to say, we had a great question just came in here. As you mentioned, kind of the losing weight, we have someone in the forum here that would like to lose as much as 100 pounds, and really just trying to figure out obviously much of what we talked about, I think, would go into that. But are there any does that number, as far as what you talked about, the number of steps need to step up? Does it need to be more? I know that there's like heart rate things out there that are talked about and things like that. What does a person need to do? Kind of maybe 2 or 3, if you were to simplify it, for to kind of move towards that goal.
So I think this is very good question. I think that each person is going to be slightly different. You may have somebody that is 250 pounds that also has arthritis in the knees and may not be able to go for that brisk walk, but maybe they can do some pool aerobics and can get the weight down that way. You're going to have other people that walking is going to be no problem, or even running. So whatever the level of activity is for that person, just incrementally increase it, so long as there's no concerns for heart disease. I think the important thing is sticking to the program.
Right.
You're going to get the results. It may take time, and I think that exercise is key in so many different areas. You got to find an exercise that works for the given person. If it's walking, great. If it's swimming, great. If it's biking, whatever works. But then stick with it, and you'll see the pounds well melt off, and especially as you incorporate the healthier foods, the fresh fruits and vegetables, and some of the other things that we mentioned in the booklet of Hope and Health.
Very helpful.
Dr. Gulley, one of the things that you mentioned, and I think it's good to give those who are watching online, some of the goals we can shoot for then would be 10,000 steps a day. That's a goal that the normal American can shoot for, and the other one is half an hour of moderate exercise. It doesn't have to be P90X or T25 or any of those extreme. It could be moderate exercise for half an hour for 5 days a week. And I'll make a personal confession. That was somewhat one of my New Year's resolutions, was to try to do the half hour. I didn't want to shoot for the hour because I knew I couldn't do it. I know my days sometimes get to be very long, and I know that setting up that whole hour aside seems realistic. But because I shot for 30 minutes, I was able to keep that very, very well, and I've been pretty consistently doing it every 5 to 6 days, and I know it's helped me tremendously. I feel better. I don't know if I look too much better yet, but I do definitely feel better. And I also noticed that every now and then when I get to go play tennis or something, that my body also reacts better. So those are some goals that we can set for ourselves. Now, Dr. Gulley, so we talked about nutrition and we talked about exercise. And at the beginning, at the introduction of the better healthcare you can get for free, one of the things that you mentioned is that there is a genetic factor, and there is then the modifiables. So we kind of left it hanging at that time, but what is a realistic picture of the impact that this can make? You cannot avoid the risk to 0%, but what difference can this really make in our lives?
So I think that the biggest issue for healthcare right now in America are these chronic diseases that take up so much of our time, our resources, and cost us so much money. These chronic diseases all have modifiable components. They can you can decrease the chance of getting them substantially by following these simple things that we talked about with diet and exercise, with getting rid of any tobacco products, and decreasing or eliminating alcohol. And so it's estimated that 50% of the chronic diseases could be completely eliminated.
I like those odds.
That's a big number. That's awesome.
If I'm able to bring it down by that much, I would definitely like to try. Joe, were you going to ask something? If not, I had
just got a couple more questions in here. So one person asked about insomnia, and I'll pair that with my own question. My wife, who I think may be watching, tells me, because I don't know for myself, that I snore quite a bit, right? And I'm probably maybe 30 pounds a bit over where I kind of want to be. Talk about maybe just kind of how some of these factors, nutrition, exercise, may play into insomnia and when snoring, some of those things just it feels like sometimes I'm not getting the full rest based on the way that I'm breathing and things of that nature.
Yes, so that brings up a very good point. There's something called obstructive sleep apnea, and that is something that happens to us as we, especially if we have a little bit of extra weight, can be just a few pounds overweight or more, but that can lead to the airway actually being collapsed when you sleep, so that when you breathe in, it doesn't open all the way, and you have to kind of struggle. Your brain has to wake you up a little bit so that you can open up that airway, and so that leads to sleep that is continually interrupted, and will lead to somebody that doesn't have good sleep and therefore is tired all day long. Even though they may be sleeping 10 hours a night, they're still tired in the morning. And there are ways, there are either surgical procedures or machines that one can use to help avoid that. But the long term, one good way to decrease that is the chance of having that is by losing that weight, and that can actually reverse sleep apnea. Same thing for insomnia. I think exercise can be important, and in good sleep patterns, going to bed at the same time each night and getting up at the same time each morning, making sure the room is completely dark. Things like this can aid with good sleep hygiene. There may be many other things that we can talk about with that.
Very helpful. Thank you.
Now, Dr. Gulley, I have a person that's very dear to me. They're a close relative, and they're also suffering through one of these chronic diseases, cancer, as a matter of fact. And they're an individual who has a typically healthy lifestyle, and what we see is that he seems to be responding very well to treatment. So you said earlier that we can probably, by doing our part, by doing exercise, eating well, we can probably reduce our chance of contracting one of these chronic diseases by about 50%. Yet at the same time, the reality is that there are some things that we cannot simply avoid by lifestyle. However, being healthier, being fit, can that help us to also cope with those diseases better and perhaps respond better to treatment? Is there any indication of that whatsoever?
Yes, so that's a great question. Cancer, unfortunately, is something that strikes many people. I'm sure that probably all of our listeners know of somebody or have somebody in their family that has cancer. Having a good baseline physical status allows for a patient to tolerate either the surgery, the radiation, or the other treatments that one might get for cancer much better. In addition, patients that have cancer that's diagnosed, for instance, best data comes from colon cancer or breast cancer. If the surgeons go in and remove that cancer, or the radiation oncologist, and then the patient recovers. If they are on an exercise program following that, they are much less likely to have the cancer come back. It'll decrease the chance of the cancer coming back, but depending on the study you look at, about half.
Wow.
That is really a profound difference. In addition,
50%.
if somebody has cancer that's already spread and they're on treatment, one of the things that treatment can cause is fatigue, and also the cancer itself can cause fatigue. The exercise programs during that time can actually substantially decrease the cancer-related fatigue or the treatment-related fatigue. and it can actually boost the immune system so that your immune system may be part of the reason the cancer is less likely to come back in patients that have been diagnosed with cancer and go on an exercise program, maybe because they're getting their immune system more engaged. We have great data suggesting that you increase the number of cells called natural killer cells that can attack cancer, as well as lymphocytes, T lymphocytes that can kill cancer cells. So these are important ways that even if you have a chronic disease like cancer, simply exercising can decrease your side effects from the cancer or decrease the chance that the cancer is going to turn out to be bad for you.
Wow.
So I'm impressed by that statistics. I wasn't expecting that, but I think that can also give everyone hope because it tells us that it's never too late to start. Even if you've fallen behind a bit and you're not doing too great, it's never too late to benefit from making lifestyle changes.
Yeah. And one of the things I know we've had an hour here basically, and there's so much I know, Dr. Gulley, we probably fill up many days, if not weeks, going through information and answering questions. Apollo just said it's never too late to start. We really want to help people to be able to start, and I know there's something coming up, Paulo, with an 8-week program that you guys are going to be having with Hope for Today, and maybe if you want to just tell folks about that. I think if people can get started and get more information over a period of time, other people that are kind of on that same journey at different stages, it could be very, very helpful.
Very good. Thank you, Joe, for keeping us in line. I had one more question that I'll save, and but there will be more opportunities to ask. And I wanted to ask, I know that the First Lady, this particular First Lady, is making a name for herself for trying to address health in the youth. And I also wanted to ask, what are some things that those of us who are parents? I'm a new parent, and I know many people are parents. What can we do? But we'll save that question for a little later. Now, Dr. Gulley, everything that you mentioned today, and we said the best healthcare you can get for absolutely free, even though I forgot at the beginning, was very intentional, because the fact of everything that you mentioned, which can save us about bring our chances of contracting chronic disease to about 50% just from the get-go, and then even afterwards it can still help us to greatly to fight those diseases better, actually doesn't cost much at all. We could say that it's absolutely free. At the same time, there are things that are not also so complicated. Sometimes, I'll make a confession. Sometimes I think that living healthy is hard. That's the truth. I say, you have to probably exercise like an hour or do that P90X and go completely vegan. Yet one of the things that I appreciate from talking to you is the fact that sometimes little steps that you can make, even if they're incremental, they can still give you so much benefit without having to being far more accessible than it is now. Dr. Gulley, I understand that on the 28th, in just about a week or so, the 28th of May, you're launching you're going to be the best guest speaker, the first doctor on a series of 8 weeks that is going to be titled Hope and Health. Is that correct?
That's right.
What are you going to be talking to us about? I can fill in later by that first session. What are you going to be talking to us about?
Well, we're going to give an overview of what impact we can have on the health of patients by doing these simple steps. And we'll also be talking about the importance of water in this simple steps that we're talking about, how important water is and how that can be substituted for other liquids like juices or sodas or coffee, tea, that I think that is part of the importance of just these simple steps that, again, it's free. Tap water, it's essentially free.
Very good. And Dr. Gulley, I was able to get a sneak peek, and those of our viewers who will join us at that time will get to meet Dr. Elizabeth Ware, who has been behind this program. But I was able to get a sneak peek, so I know we'll be looking at, for example, water, fresh air, exercise, sunlight, stress. We'll be looking how stress can impact our health, and something that's also very unique in this series is called Hope and Health. Also, how having hope and trusting in in gut can also impact our health. So all this will be offered in a series of 8 meetings starting on May 28th, which is a Wednesday, from 6:30 to 6:30 to 8 p.m. They'll be offered this meeting. They'll be able to meet doctors, and I know that Joel has been working on a little promotion. So how can we get more information, Joel?
Yeah, absolutely. So everyone that attended this webinar, you can go to findhopetoday.com and get more information about it there. But you'll also get information on your email as well with it. Another thing that we'll do at some point is make this video available so you can be able to link to it and share it with your friends and family. I'm seeing various comments that this was very useful information, so we're really, really happy to hear that. It's really encouraging. There's so much more, as we said, that just couldn't be covered in an hour. So yeah, you'll be getting information about that. It's free to be able to register and get it out to your friends and family and have as many people be able to attend as possible. It's in Tacoma Park, Maryland. Is that correct, Paolo?
That is correct. It's in the campus of Washington Adventist University. They're in Tacoma Park, Maryland. And if you stay tuned to your email, you will receive the address, and you'll be able also to register. The sessions this is the first time we do this session. Some of you may have heard also about vegetarian food from around the world. That was another sponsored event that Hope for Today sponsored. This is on that series, and this is the first year we're doing all these things, so it will be free this year. We cannot promise it'll always be free. But it will be free this year if you register. You still have time till Wednesday 28 to register. And again, it'll be 8 different doctors who will be coming. Dr. Gulley, who we had a pleasure to talk to today, will be opening up this series on the 28th. But then there'll be different doctors that will be featured each week talking about each of these things. As Dr. Gulley just said, they're absolutely free, and they can give us so much benefit. The healthcare in America would look so much different if we were able to take this decision. Something that I like that Dr. Gulley said that I like, and perhaps I'll let him see, is that a lot of this has to do with us. Correct, Dr. Gulley?
Yes, I think the most important key take-home, if you just take home one thing from this, is the desire to change and make a better choices for your health has to start with you.
Very good. And at the same time, we're here to help. And if you make that decision, we are here to offer all the support we can. There will be also many other people that will be coming, so you'll be able to share your experiences, find support from each other, accountability. Yet ultimately, the decision is yours. So we really, really hope we can see you there, and that you'll decide to join us on May 28th and every Wednesday after that. Joel, thank you so much for joining us.
Absolutely. I learned so much. I appreciate being able to be a part of it. Thank you, Dr. Gulley. Very, very useful, I'm sure, for the audience and useful for me personally. So much appreciated.
All right. And Dr. Gulley, thank you so much. I know you're such a busy person. I know you travel all over the world, but we appreciate you taking this hour for us. And I hope that people online appreciate it as well. And for all those questions that were left in our minds, May 28th, I hope to see you there. Thanks. Good night.
Exactly.
I'll see you later.
Thanks, everyone.
Take care. Good.